welcome to Ordinary Miracles. Ordinary Miracles is a show about healing and expecting miracles. I myself have been on a 24-year journey of healing, and I'd like to share that with you, and I would like to really showcase the different healers that I've worked with and show you how brilliant they are and how healing is possible for everybody, wherever you live. There are people like the healers I've worked with all over the world. So anyone who's been in chronic pain will understand that you will try anything, no matter how weird it is, to get better, right?
Absolutely.
And I have. So this show is really about remembering that there's magic in the human touch and to really expect miracles in our lives. So my first guest is Cheryl Russel. Cheryl, thank you so much for joining us. I would like to explain to you how I met Cheryl. In January, I had bronchitis and I was really, really sick. I couldn't shake it, and so I went to the doctor and I said, give me something to get rid of this. She said, are you allergic to anything? I said, no, definitely not. So she prescribed Levaquin, which is a family of Cipro. So I took the Levaquin. A few days later, my heart started beating fast. I started feeling really bad. So, when you see on TV those ads that say, the disclaimers on the medical ads for the medicines, if you are dying or you can't breathe or your heart starts racing, call your doctor and stop taking this medication. Well, that was me. My entire nervous system shut down and I couldn't get out of bed. My sister-in-law came from LA to look after me, and I couldn't believe it. And so somebody recommended Cheryl Russel, who does cold laser relief therapy, and I went to see her, and I could hardly even walk into your office, do you remember?
Oh, yes.
And I was shaking as if I had Parkinson's.
Big tremors, large tremors,
yeah. It was so scary. And Cheryl, after one treatment, just one treatment, I stopped shaking. So I really wanted you to explain to everybody, about what you do, but before I do, let me tell everybody about you. So Cheryl Russel is a leader in the medical massage industry and also cold laser therapy, and she really focuses on soft tissue and chronic pain and acute injuries. So Cheryl also worked at Lenox Hospital and developed a program many years ago for the nurses to massage premature babies. Oh, I love that, Cheryl. Yeah. And then you worked in hospice and you worked with gravely ill people.
Yes.
Also, so great that you did that. And then after 9/11, you offered free massages to any of the volunteers who really worked in the trenches. So without wasting another minute, let's find out about you, Cheryl, and how your journey started.
Okay.
So go ahead, tell us, how did you get into this?
How I got into the medical massage therapy?
Yeah, cold laser.
Well, medical massage therapy I did basically because I had to survive. I needed at some point something that I could do to support myself and my children, and it needed to be something that was rather quick. I couldn't go into 4 years or 6 years of college. So I decided to do medical massage. Well, I decided to do massage therapy. Within the massage therapy world, I figured it would be best if I found a niche. So I found that I wanted to go into the medical aspect of massage therapy. So I did that for about 17 years.
Wow.
And in doing that, I used my hands and my arms and my upper body a lot. And what happened was my elbows, I came down with what's called epicondylitis, which is like a golfer's elbow or a tennis elbow. Of course, mine wasn't from golf or from tennis, so we called it epicondylitis. At that time, I went the route that everybody else went, where I went to orthopedists, and I had cortisone injections, which now I know are no-no for me, at least.
Yeah.
And for my patients, I try to encourage them not to get cortisone injections. It breaks down tendons. And I needed something. I did 2 cortisone injections in my right elbow, 3 cortisone injections in my left elbow. Physical therapy, all types of different alternative acupuncture. I went the route of medication, the route that we all generally take medically to try and help these chronic conditions.
Right.
And it was about 7 years ago that a neighbor of mine mentioned that he was going to use this new technology to quit smoking.
Wow.
And yeah, I thought he was out of his mind. And he told me it was cold laser. So,
See, so people hear cold laser and they freak out.
yes.
So tell us, what is cold laser?
Okay. There are two types of lasers. There's cold lasers and there are hot lasers. Hot lasers are what we're mostly familiar with, and hot lasers tend to cut or burn, or we use hot lasers in surgeries, etc., some dermatological uses as well. Cold lasers have no thermal heating. Cold lasers are used in such a low power that it does not heat tissue. So because it does not heat tissue, it allows the cells to actually absorb the photonic energy. And the photon energy triggers a healing response in the human body.
Okay, so who can this what kind of conditions can this cold laser therapy help?
It's very interesting you ask that question, because I often hear that cold laser helps. You know, it sounds as though cold laser is this miracle that helps every single condition. It's not that cold laser helps every single condition. It's that, like I said before, that the cold laser triggers a healing response of your own body. So that most conditions that we have in our own bodies, if we restart your healing process, your body itself will heal itself. Our bodies are a miracle, really, really, truly a miracle.
That makes complete sense to me. I know I've brought my daughter to you, she twisted her wrist,
Yes.
and the doctor thought it was broken, and 3 treatments later, she was totally fine.
Yeah, reduce the inflammation immediately, just about. With the first and second treatment, reduces inflammation.
What I love about Cheryl is, just, you know, in that movie, My Big Fat Greek Wedding, where the guy says, you know, he uses Windex for everything.
Yes.
Cheryl's the same with cold laser. She's like, just throw the laser at it.
Yes, let's just throw light on everything and see what happens.
And it works. I mean, I had a crown, and you put the laser on, I felt great.
Yes.
I was stupidly tried African drumming, which I wanted to try.
Thumbs
Last week
blew up.
my thumbs blew up. 2 treatments with the laser, I was fine.
Yes.
So I'm a big believer in the laser. So who can become a cold laser therapist?
At this point, unfortunately, there's not many regulations with the cold laser at this point, unfortunately. The United States achieved FDA approval in 2002. It's still not very well known. You say cold laser and people say, what? Yeah. What is that? And the word laser actually scares many people. So the word laser really is an acronym for light amplification, stimulated emissions of radiation. And then again, everybody says, oh my God, radiation. We get radiation from all light sources. We get radiation from so many different things. We're sitting under lights now here, we're sitting with lights here. We're actually getting more radiation from these lights than you are getting with our cold lasers, which is very interesting. Again, it's very, very low power. So we're not absorbing radiation as we all think of the word radiation, and we all think of the word laser as injuring or hurting us.
Okay, so that's good. And I remember when I came to you and I said, you know, how do you know if it works? And what you said really made me feel comfortable. Yeah, you don't, but you did say that you would know. Can you explain to our listeners the percentage of people who it helps? And
yeah, we do. Everybody metabolizes light at a different rate. So our bodies have to metabolize light. Not everybody metabolizes light, and everybody metabolizes it differently. So it's hard to say when you're sitting in front of me in my office, are you going to be a candidate? Are you going to absorb the light and metabolize the light? Most of the time, yes. We have approximately 93% of all people absorb light. Out of those 93%, you absorb light differently. Whereas some people can absorb light very quickly and it's magical. You happen to be one of the people that it is somewhat magical before. Unfortunately, I am not. I am very average. So if you and I both had the similar conditions, where you would come in and it would be 8 or 9 sessions, it might take me 12 to 15 sessions. But then again, we might have people who metabolize light even slower, and it might take them anywhere between 18 to 30 sessions. We have a general rule of thumb in my office. Light is very interesting, and healing with light is even more interesting there's a lot of science behind it, but there's an art within that science. And that's what most medicine is. If you find true healers within the medical community, is to find that art within the science. So in finding that, I have found treating with light it's very specific for me and how I treat in the office. We will try 7 to 8 treatments over a 3-week period of time. Yeah. Because as we use light, we also need to allow your body to absorb it. We need your body to start the healing process. And we need the body to start healing. So it takes about 3 weeks for us to know if you're really metabolizing light. Now, most of the time I know within the first week, but I like to tell my patients expect the first 3 weeks because we're not sure which category you're going to fall into. Are you going to be magic? Are you going to be average? Or is it going to take longer? So typically by the 3rd week we know for sure.
You don't waste people's time.
No.
And
I've
seen that in your office.
Yeah, it wastes your time, your money,
right.
my time,
Absolutely.
and the energy of the equipment that we use.
So I've come to know you really well, and I see how much you care so much in your heart about healing people. And I want to get to some of your miracle stories, because after all, this show is called Ordinary Miracles, and it's about healing. But I know how much it disappoints you when you can't help people, when someone comes in and you really, intuitively, and you think about how you can help them. How do you deal with those disappointments?
It was a lot more difficult in the beginning when I did come across that 7% of people who just don't metabolize light at all. It's painful for me. Yeah. I know that we can heal so many people and so many issues and problems, and when you find someone who just doesn't metabolize light at all, it's very frustrating. In the beginning, I almost took it personally. I did take it personally. Yeah. That maybe there's something I'm doing wrong. Maybe there's something I'm missing. I can look at it in a different way. Now it's a little easier now that I've had 7 years of some disappointments, and unfortunately when people just don't metabolize light, I have to tell them I'm so sorry, but you're one of that 7% and you're out of the program. And people get very upset when they say, what do you mean I'm out of the program? They don't want to be out of the program, but unfortunately light is not going to help you. We have to find a different avenue for you. Thank God it's only 7%.
Yes, thank God. So when you work on me in the medical massage, you said something to me that a patient had complimented you and said, you intuitively think it's like each of your 10 fingers has their own brain.
Yes.
I love that, and I feel that when you work on me.
Yes.
Each finger goes to a different place, and I walk out of there, okay, it hurts, it definitely hurts while you have a massage, but I walk out of there and I'm like, and I feel great, and it helps me so much. So can you just explain a little bit about the medical massage?
Yeah. Also very interesting, at this point, we really don't know how to classify me. One
in a million.
I don't do your typical massage.
Yes,
I also don't do your typical medical massage. My knowledge of anatomy is what's helped me tremendously. So where to put my fingers, what I feel, what I pick up from my fingers, tells me where to go and how to work within that tissue. Knowing the exact position of my fingers and what anatomically I am on. So when we look at you overall and we see basically your skin, your body, the outlines of you, whereas I can come in and pinpoint exactly just by looking at you that this is your bicep tendon right here.
Right.
So knowing the anatomy the way I know it and what it should feel like over 23 years of touching different parts of the body, that's really what I do. So I work a lot within tendinomuscular junctions, tendons. So just as a quick information, our ligaments attach our bones to bones and give us stability. Our tendons attach our muscles to our bones, which allow us movement. So I work a lot within the tendinomuscular junction, where the muscle starts turning into the tendon, which then attaches to the bone. And by working with adhesions and scar tissue, when we have a damaged tendon or a damaged muscle, typically it's a tear or it's micro tears, that's causing us pain. It causes inflammation. By going in there and being able to feel the thickness of that tear and the adhesions in the scar tissues that are forming to heal that tear, I have the ability to come in there and break that down and to feel it.
Wow.
And then once we break it down, which is a controlled form of injury, once we do that, then we allow your body to heal. And again, from there, we can accelerate the healing process using the cold lasers.
It's so brilliant. And I feel you doing that. I feel you breaking down that scar tissue
and it hurts.
It hurts a lot. It hurts so good.
Yes.
It's like that. So for you, what's your favorite part of doing this work?
When I graduate patients.
Oh, that must feel so gratifying.
Yeah. It's also, you know, nobody really ever asked me that question. So in thinking about it, there's always a point in time with which, you know, because it's not well known, people come in extremely skeptical. Extremely skeptical. And I was myself, you know. You just can't tell me that some light and some red light is going to heal my tendon. You know, I'm in the medical field. There's just no way that this red light is going to heal a tendon. It just doesn't make any sense to me. So there's always that point with each patient that it's working for and that does metabolize light, that this light bulb goes off like, you know, I feel better. I can't believe that I feel better. And when that light bulb goes off in them and you see that on their faces, that's really gratifying. That's my favorite part, when the patient's like, oh my God, you know, this is really working. I love that.
I feel that.
Yeah.
That's a gift.
Yeah.
That's a gift. So share with us some of this is called Ordinary Miracles. So share with us some of your miracle stories.
There are so many. One of my most, well, I can't say interesting, but there was a time, my first patient who had shingles came in. Yeah. She was an older woman, probably in her mid to late 70s. And she had shingles pretty much clear across one entire side of her body. Wow. And the pain was so severe. And she really could barely get into my office. She was almost crawling on her hands and knees. And I'll never forget it because one of my staff members, Martina, who you know, came knocking on my door. And it's like one rule in my office, you know, you don't knock on my door unless, God forbid, there's a fire. Right. So Martina came and knocked on the door and, please, you have to come out here, because the woman was in such severe, severe pain. Martina didn't know what to do. So we brought her in and we started treating her very specifically for shingles. And the aftermath of shingles, which is post-operative neuralgia, which is extremely painful for a very long period of time. So we started treating her. The first day that I treated her, she really cried through the entire treatment. And I remember getting in the car going home after that treatment, picking up the phone and calling my own mother and crying. And so I can't do this. I just can't do this at all. It was too painful for me to even treat the patient. Yeah. She came in the next day, and I treated her the second day. Again, extremely difficult and extremely painful. And she came in the third day, walking upright, still in a lot of pain, excruciating pain, but we were able to get about 15% of her pain down.
It's huge.
Huge. When you're talking that amount of pain, to reduce your pain by 15% is unheard of.
Any degree helps.
Yeah.
Anything that even slightly lessens the pain.
Yes. So she took probably, I believe it was 7 to 8 treatments, to the point where she was 60% improved.
Wow.
And then we dropped her to once a week, and we probably saw her for about 2 to 3 months to prevent the post-operative neuralgia. And she's been fine ever since, thank God.
There you go.
Yeah.
Ordinary miracle.
Yeah.
I Just want you to share one more thing with our viewers. When you, one more miracle story, when I first came to you, and I remember feeling like I'd lost my life force. I couldn't even talk. And you shared a story with me about the man who was shaking so much that he couldn't read. Can you share that story with our viewers?
Patient came into the office and presented with very large tremors, like very large. And there was absolutely no reason for his tremors whatsoever. He had suffered these tremors for 12 years. It affected his voice. He would talk like this when he spoke, because even his voice had tremors in them, and his head would bob like this, and there was no way that he could read. There was no way that he could really function the way he knew his life used to be. And this was 12 years.
Oh, God.
Yeah. So he came into the office. He had actually read a book, which is a fabulous book called The Brain's Way of Healing by Norman Doidge. And in the book, Norman explains some information about cold laser therapy as well. And that's how this gentleman got to me. He looked up cold laser therapy, found my website, found me, he came in. We did one treatment, very similar to yours, with your tremors due to the Levaquin.
Yeah.
And he felt an immediate difference. He still had large tremors at the time. We only did one treatment. But he felt an immediate difference. So he continued coming again, and he came within that first 3-week period of time. At the end of those 3 weeks, he was amazed. The man actually got on a plane, which he hadn't done in 12 years. He flew, I believe it was to Texas, for his son's wedding, which he never thought
Goosebumps.
that he'd be able to do. And he was able to go to his son's wedding, which was absolutely a miracle, an absolute miracle. And every day that he came into the office, he would cry. He would cry. We have since graduated him. He is at the point where he can write.
Wow.
He can feed himself. He can read. He can work a bit. Again, stress plays a big role in many conditions in all of us.
Absolutely.
So when he's extremely stressful, he'll feel a little bit of his tremors starting to come. We have taught him some meditation, coping skills, ways to cope with his stress. He also has a unit at home now, because for him it's very important that he continues ongoing treatment. Now, he came to me from Manhattan, and it was a train, so he'd take a subway to the station, and then the train to the train station where I am, and then walk from the station to my office. And we were able to give him a unit at home, and he treats himself at home now successfully, and it's a wonderful, wonderful story.
That's a proper miracle. I love that story.
Yes.
So, what's your vision for yourself? Where are you going with this?
I see myself teaching. I see myself really going into teaching, lecturing. Teaching is probably one of my other passions. I would really love to teach. There are many differences with light therapy, basically. There are many different types of... There's so many manufacturers out there now, and unfortunately, manufacturers like to make money. And I have found in my journey of learning light therapy and learning cold laser and treating tissue with light, that you can't really learn from manufacturers, because manufacturers really want you to purchase their equipment.
Right.
And I unfortunately did that in the very beginning, and it cost me a lot of money, a fortune. This equipment is not inexpensive at all. So it really cost me a lot in learning what equipment I didn't want, why it didn't work. So, my advice to many out there would be to really learn about light, why you want certain wavelengths, certain nanometers, certain power outputs to affect different types of tissues, depth of tissue you want to affect. So there are very many different laser systems. Part of the problem that we're having now in the industry is that there are physicians and chiropractors and physical therapists and occupational therapists who are now hearing that, oh, this cold laser works. And they're doing some investigation in different pieces of equipment, and they're purchasing equipment based on finances, which is huge, not really learning how to treat with light. They're using it more as an add-on to what their specialty is. So a chiropractor will add it on to an adjustment. Physical therapists will add it on to their physical therapy. Rather than really learning how to treat with light and be, I am really striving to build a standalone cold laser clinic. And that's how we got to cold laser relief.
Yeah.
So a lot of these other physicians and chiros and PTs now are doing what I call point and shoot.
So that's important, and that's what I learned in my journey, is that you really have to do your research. Find the experts, the leaders like Cheryl. There are brilliant practitioners out there who really work from their heart, and they've educated themselves, and they don't just take a machine and point and shoot. They really want to understand the functionality and why it helps you and how it helps you. And that's really important in this journey of healing. So Cheryl, how can our viewers get hold of you? Can you give them information on your website,
Sure.
phone number?
My website is coldlaserrelief.com, all one word. And you can go to my website, there's a lot of information there. My office phone number is 516-773-0020. My staff is wonderful. You can get them on the phone. They will give you a tremendous amount of information. And if need be, I jump in on the phones all the time. There are many times that I will answer the phone myself.
It's true.
Yes. We're all hands-on in the office. My office is very transparent as well. When you walk into my office, everything is wide open, and our conversations and everything are done in front of everybody. We hide nothing in the office at all.
Very comfortable and safe. I felt safe and nurtured. Sometimes I go there and I think, oh, I love starting my day this way. So I really want to thank you for sharing your gift and for your service with the world and for being such a healer from your heart.
Thank you.
For me personally, it's meant a lot, and for everybody who you work with. And for all of you viewers out there, just remember that there is magic in human touch, and expect miracles. Thank you, everybody. Goodbye.